Hi, hello, namaste. This is Ankar Sharmi and welcome to Qube TV. Right now, I am in Dr. Kate's hospital. So, I am having a general physician and consultant doctor, Dr. Imran Khan. So, let us talk about this viral infections and viral fevers running around in the monsoon season. Hello, sir.
Hello.
So, sir, monsoon season is a very beautiful season. Even though it's a beautiful season, we are like afraid of this infections, viral fevers, coughs, and many other things. So, can you explain us why only we get such type of infections in monsoon seasons?
Yes, it's very important question, and we need to understand it. See, in monsoon, what happens? If you see, it's a very comfortable season. Temperature is down, everything is green over here. The problem is the rapid urbanization of the surrounding. What happens? We can see the all over the concrete jungle around us. So whatever the rainfall is coming, they are accumulating and causing flooding and overpouring of the water around. And what happens? The sewage water or the wastewater, the water which is coming over the rains, which are coming over the garbage dumped over areas, they got all mixed up with our drinking sources. Like they can mix up and enter into our well, tube well, or sometime our drinking pipeline is leaked. There also it can enter, and it can enter and come to our glass of water which we are drinking.
Okay.
So that is the issue with monsoon. That is the point number one. Second point, due to the accumulation of water, there are certain insects, mosquitoes, which start breeding more in monsoon season. They are sometimes act as a vector which transmit infection to us in the form of malaria, dengue, and what we talked earlier, the sewage water, they can cause some fecal infections like hepatitis. Sometimes they can cause acute gastroenteritis like acute diarrheas. These are the things. Sometimes viral hepatitis also. Yeah, these are the things which happens usually in monsoon. And once these are spreading in our community, there will be people around us, there will be people in our community which are having that disease, and those people also start giving disease to the
Other
normal
people.
healthy people. That's how the bonanza of infection starts multiplying in monsoon season.
So, doctor, whenever the monsoon season has been starting, the weather changes very drastically. So, people are like very terrifically they fear, just because even there are some people who don't even go out of the house if it is a monsoon season. So, could you say them some precautions before going to any workplaces or anywhere? Can you say some precautions, doctor?
Yeah, first thing, what we are drinking, we need to think about from where it is coming, whether it is a safe source or whether you are doubtful about the source. That we need to question first. It's always better to carry your own food when you are going outside for a job or for some other reason. Or also you can carry water bottle from your home, so that chances of getting some contaminated food or water will decrease drastically in this thing. This is point number one.
Okay.
Second, whenever you are venturing out in monsoon, try to limit or avoid street food.
Okay.
I know that everyone will be very tempted to eat.
They'll be very craving to eat.
Yeah. But hold your temptations in the monsoon or early phase of the monsoon. So that is point number second. Point number three is like you look around your surroundings, whether any accumulation of water, whether any accumulation of garbage, or whether any accumulation of whether you are able to see any breeding places of mosquitoes or insects or houseflies. Try to eliminate them. Just try to keep your areas dry. Don't allow water to accumulate around. And if you saw breeding larvae or of insects, you can use some insecticides or clean up that area. In this way, the transmission of this kind of infection will decrease in a great way. Government also will try to help you in this.
Yes,
but
sir.
at your level also, you try to keep your surroundings clean.
Okay. So, doctor, comparatively with other seasons, if we compare monsoon season, kids will be more attracted towards go outside or have fun in the rain, and then they get fevers or coughs or whatever the health issues. Can you say them the specific problems after, platelets will get down drastically because of dengue, malaria, and some other extra disease and infections we get? So, sir, can you say some preventions for that?
This is the another aspect of monsoon. When we are facing high temperatures during summer, and suddenly the temperature and everything changes when the monsoon starts. Temperature drops, you will have high humidity, you will have rain outside. Let the body to adapt for some time. Have healthy, balanced food so that your immunity is become stronger. Sleep properly, around 7 to 8 hours for adult, I will say. So this thing will keep strong inside. So sometime if you get wet in the rain also, you may not fall ill.
Yeah.
But there are certain susceptible people or patients, or we can say, they need to avoid this kind of thing, misadventure. Like some are diabetic patients, some are kidney patients, some are already having some low immunity. They should avoid all getting into this trouble, right?
So, doctor, whenever it comes to the viral fevers and dengue, both have the main similar factors like fever, getting totally ill, and rather some symptoms will be same compared with fever and the dengue. And how could people recognize that whether it is a fever or dengue?
Dengue is also a viral fever. Okay. There are certain other viral fevers where they have a differentiating point from dengue. Like if you have a common cold, it will present differently. Dengue will present differently. Malaria will have a different presentation. To identify dengue, I will say the highlighted point will be like it will have a very high grade fever mostly. The fever will be consistent throughout the day and night in initial days of the dengue, right? After taking paracetamol, it will decrease over for maybe hour, or like again it will come up. And they will be having terrible body pains in dengue. And in some patient, it may have some loose motions also. We have seen some patient with loose motions. Some patient may have mild cough also. So there can be a, what we can say, the basket of symptoms
Yeah.
in the patient with dengue. So whenever the fever is there, should not be very lenient about it. Show to a doctor and have a proper advice and go forward. And other fevers like just a simple upper
Normal
respiratory
fever.
tract infection or something, they will not be, mostly will not present with very high grade fever and this thing. They have received different kind of set of symptoms. Like in case of malaria, if you say, the fever will be intermittent. For 3-4 hours, fever will be there. Then maybe a whole day fever may not be there. This kind of thing can happen with malaria. It's an intermittent fever. It will present with chills. There will be, patient will have cold kind of feeling in malaria, and extreme weakness both in dengue and malaria. Usually these are the history points where we differentiate.
So, doctor, whenever there is a dengue problem, there is one more situation which every kid or every adult face it: low platelets, and people get worried very soon. So, when to worry? Like how much count should actually be, and when they get affected by dengue, how much count they will decrease?
Previously, when we used to have dengue epidemics, there was a huge, what we can say, panic situation in the community that his platelets are low or they are falling down. What's going to happen? See, platelet is a cell in our blood. There are, in the common language, we can say there are red cells, white cells, and yellow cells. So the yellow cells, we call it platelet. Their function is to stop bleeding. Whenever some bleeding is happening or there is a tendency to bleed, they will stop. This platelet will act and they will stop the bleeding. So if you see in a other way, if platelets are low, there is chance of having bleeding. So normal platelet count is more than 1.5 lakh. It will be, upper side will be 3.5 lakh to 4 lakh something. So usually when in dengue, in most of the, in a huge population, huge cohort of dengue patients, they will fall in a modest way. They will be falling around 1 lakh, 1.2 lakh around that. After that, they will rise. So above 1 lakh, no issues. Even you can take treatment at home. Yes, it's just platelet is not the only thing which decides him to be admitted or not. But more than 1 lakh and other things are okay, you can take treatment at home. Below 1 lakh, you should get admitted. And if the platelets are falling below 50,000, you need to check it twice a day, morning and evening, so that there can be sometimes this sharp reduction or sharp fall in the platelet sometimes. And if below 20,000 to 10,000, that time we need to worry. In that range, there is a high chance of bleeding, and that time we need to think about platelet transfusion. That is the thing. From 1.5 to 1 lakh, you can think about home treatment.
It's a good one.
Yeah, 1 to 50,000, definitely in hospital, but once in a day platelet count. Below 50,000, twice in a day platelet count. Below 20,000, think about blood transfusion. That is the thing.
Okay.
Anyway, this is not a blanket rule. We need to individualize according to the treatment. If some patient may have bleeding early also, so we need to transfuse platelet early also.
So doctor, when it comes to medication, most of them are addicted to home. Right now, no one is interested to come to hospital and get checked. So can you say some precautions or prevention that could be done if it is a light way of viral fever or a short, they could acute dengue kind of thing. So can we do something in our houses without consulting doctor?
So it's a bit tricky question. When the things are going to take a means a bad turn, we cannot decide or we cannot forecast it.
And even people are getting addicted towards home therapies and home.
Some people take antibiotic also.
Yeah.
So what happens is sometimes a serious infection like sepsis or something, it will start with a mild fever, right?
Okay.
When there is a fever, definitely you can, if there is no contraindication, you can take paracetamol, you can take more fluid, you can take a lighter diet, more of liquids. That thing you can do at home. But if fever is not reducing, there are other symptoms, definitely show to your doctor and see what the fever is about. There are numerous causes of the fever. Definitely there are causes which are very self-limiting. Without taking anything, they'll
get fever. Yeah.
Right. And there are causes which, if not addressed in a time, will cause a serious harm to the body. So we will say better have a consult with a doctor, and definitely these are the precautions you can take at home, but consult a doctor.
Okay. Sir, what is sepsis? And exactly in the same monsoon season, we get many other infections. So can you explain each and everything?
Or serious infections.
Serious infections.
Sepsis or serious infection is a thing which we require ICU admission.
Oh my God.
Yeah. So what happens, because of the certain pathogens, body starts responding in a very what we can say haphazard way or very advanced different way.
Yeah.
So the WBC count or the white cell count will increase in a more than 13,000-14,000. Sometimes it reaches to the 30,000 or 40,000 also in this kind of sepsis. Second, your heart rate will be higher. You will have tachycardia. There is a chance that you will have very low blood pressure because of the severe infection called as sepsis. Fourthly, we can, in this kind of patient, other organs can be affected. Like if, for example, sepsis is due to a urine infection, right? There is an infection in the urinary tract. But if patient is having sepsis, he may develop remote organ injuries also. He may have a kidney injury, he may have problem with the heart also, he may have very low blood sugar and shock, and he may develop encephalopathy also. So when we are saying sepsis, it means it's not just an infection, it has a very huge, what we can say, impact on our body, and that to be taken care with the expert opinion or with the expert suggestion only.
So doctor, how do we decide that regarding there is a problem and what antibiotics would you refer to the patients, or nowadays patients are like Google, there is a Google option and they're Googling it and just going directly to the medical shop and they're getting it. So would you recommend antibiotics to your patients, sir?
Recommending or suggesting antibiotic is a well thought process behind every patient.
But there is
We have
also a
to
negative thought of it, sir.
Individualize the treatment also. So, what is happening nowadays is a very common scenario that when person is having fever or some throat pain or some cough, he will go to a pharmacy, he will get some antibiotic. It's not that much easy. When as an expert, as a consultant in a general medicine, and we are seeing the infectious diseases, when the patient comes to us, we think about whether this is a bacterial infection, or it's a viral infection, or is it fungal infection, or it's or any parasite like malaria is there. Malaria is a parasite. So is a parasite infection. We have this all possibilities in our mind. With history, clinical examination, and sometime investigation, we come to a conclusion that, oh yes, this is a viral infection, we don't need an antibiotic, or there are certain viral infection we give antivirals. Then comes bacterial infections. Then we decide, then we think that whether it is a gram positive kind of bacteria, whether it is a gram negative kind of bacteria, or it can be anaerobic infection.
Yeah.
For example, if there is a aspiration pneumonia or aspiration in the lung, we'll think about anaerobic infections. So, or dental abscess, or there are anaerobic infections. So, the antibiotic what we are going to give will be different from a gram positive, will be different for gram negative, will be different for anaerobic infection. There are certain antibiotics which covers all, but they have their potential side effects also. There are certain indications where we give them, right? And coming to antifungal, again we decide which antifungal to give, whether it is just a mild superficial skin fungal infection, or whether it is a systemic infection where the higher antifungals are to be given. Parasite is a different story, malaria is a different story. So this is the thought process behind that. So if you just go and take a tablet, initially maybe for 2-3 days you will feel well, but if you have taken a wrong thing, that golden period of treatment is gone. So diagnosing in 1 or 2 days and diagnosing after 5 to 6 days is a different thing. There are chances the body may get permanently hurt after diagnosing late with antibiotic and giving antibiotic very late. This can happen. So early diagnosis and giving a proper antibiotic is always good, right? So I think I have answered.
Yeah, I got the answer, sir. So, sir, coming to the point of vaccines, what are the main vaccines that you prefer for adults who need some energy to fight with the monsoon season or whatever the infections or the fevers we get, to fight that? What are the vaccines do you prefer, sir?
Vaccines are something which produce antibody in our body, and they are prophylactic, or they prevent from infections. So there are certain very well working vaccines available in our in India or in a current scenario, like pneumococcal vaccine. Pneumococcus can cause pneumonia, can cause meningitis, severe brain infections and all. Those pneumococcal vaccine is there. Meningococcal vaccine is there. It is also a very notorious bacteria. Then there are vaccines for hepatitis B, very effective vaccine. So you can have a hepatitis B vaccine. Then tetanus vaccine, everyone knows that. Everyone is aware of tetanus vaccine. It is also recommended in adults. Then recently we had a COVID era. COVID vaccine, mostly people have taken COVID vaccine. Then one more important thing is when this influenza epidemic starts, usually in a year, once in a year, we are seeing epidemics like with swine flu and influenza. So swine flu vaccine with certain other prototypes of influenza, one vaccine is there for this influenza thing. So these are the main vaccine which we recommend.
Okay. So as a doctor, what are the food items would you refer to your patients, doctor? Because in the monsoon season, we get many other problems, not only the viral fevers. Without any reason, people feel ill, but there is nothing in their body. There is no cough, there is no illness, there is no fever, nothing. but they feel drowsy and they don't want to work, nor they wanted to sit in the house. So for those people to fight with that infection or whatever is happening in their immune system, what would you prefer as a food, sir?
There are no superfoods. I don't believe in superfood that you will eat a apple a day, you will keep the doctor away. This doesn't work like that. So, what our body is a very complex thing. It requires complex material to take inside. So, we need a proper balanced diet. There is a term called balanced diet. We should take that. So, it should have a appropriate carbohydrate, appropriate amount of protein, appropriate amount of fat, and recommended amounts of vitamins, various vitamins and minerals also. So everything is important. When you take a balanced diet, your body will have a good potential to fight against infections, to good potential to be free from several other diseases, including non-communicable, non-infectious disease also. If you don't take a balanced diet, you will be in trouble. But on an average, we can say the food which is good in vitamin C and other vitamins to be taken more if you have an immunity issue like vitamin C, like guava or amla and all other fruits also. They have a good amount of packed up with the vitamins that should be taken.
Okay, doctor, when it comes to monsoon, and there are many people who are like who have to go to office, and some people have to go to school as a teachers or as a students. They feel so much of struggle because continuously their nose will be like a running nose, and sometimes they get totally shiverness and cold fevers. Cold fevers are mostly found in monsoon seasons. Could you say some precautions to be aware of this, sir?
See, it can be two types. One is allergy type. If it is happening due to change of the season and it's allergy, those people will be having frequent cold and sneezing and sometimes fever also. These are allergic type of things. So these people should be keep themselves away from dust, keep themselves away from getting wet into the rain, and if the allergy is kind of causing so much symptoms, you can take anti-allergic medication with consulting a doctor and making a plan. Like whenever you have this kind of symptom, you can keep a drug which will help you in this kind of scenario, because they will be having repeated these things. So they should make a plan that whenever I have started this thing, I should take this kind of medicine, anti-allergic medicine, to avoid the onset also and sometimes the early relief also. Now the second part is infectious. So you should avoid, the thing is infectious is it's transmitted from one person to other person. So you should try to avoid very crowded places, right? If small room is there, too many people are there, there is very high chance that infection will transmit from other. Second thing, have a basic hygiene. When you are sneezing, put a handkerchief or something so that it will not be transmitted to other. You can simply wash your hands before food and after after using toilet, and take bath daily. In this way, you should drink water from a right source, and you should take food in a way that it's cooked properly at home or outside if it is safe to you know how it is done, and that should be the way.
Okay. So, sir, when it comes to the monsoon seasons, there are many people who drink hot water, and there are many parents who advise their kids to use nebulizers. So, would you recommend that, sir, as a doctor?
No, it's nothing. I don't think is any health benefit will going to give you if you drink hot water. And I have seen few patients where that patient were taking so much of hot water, and they have injuries in their esophagus and stomach also after doing endoscopy. So I don't think any role is there with continuously drinking hot water or something. When you are having cold or sore throat, definitely you can take a lukewarm water to drink. It will soothe the throat and it will help in what we can say is better circulation while when your throat is congested. Apart from that, you should take a normal temperature water. Avoid cold water, but don't drink hot water also. Just take a normal temperature, room temperature water. The second is nebulizer. Nebulizer is a machine which breaks down our drug to a very small molecule, and that molecule enters into our respiratory tract inside, right? So it has a different purpose. We want to deliver that drug inside the lungs. We give in case of asthma, in case of chronic obstructive pulmonary disorder, and in certain other illnesses. But you should not make it a regular habit of giving nebulizers or something. Sometimes if nebulizer contain beta agonist medicines, so they can cause sometime tachycardia to you, they can cause shivering, tremors to you. They can also have some side effects, right? So don't do it, and take a consult and then decide about it.
Okay, so sir, finally, when it comes to monsoon season, and most of them, our grandparents would always say, take vaporization, have some tablets before medication. Before medication, they'll start medicating children with tablets or those vaporization without having any problem. Would that is that the process is good or bad?
No, nothing. It will not. I don't think it will help vaporization before starting anything. You practice safe things, safe hygiene, safe your proper balanced diet, proper sleep, and don't be in crowded area. Have a sanitation around, and also be clean. That will help you.
So doctor, finally, what would you want to say to your Qube TV viewers who are affected by, even they are not affected, I hope everyone are healthy and safe, but what you would recommend them to be, who are in houses, what would you recommend as a doctor, sir?
Particular to the monsoon, what we have said is, it's a period where you are very prone to get infections. So try to be play safe, like drink water from a right source, safe source, take balanced diet, then take sleep properly. Don't suddenly venture out into the heavy rains, and also try to be safe while traveling, while riding bicycle or while riding a vehicle, because there will be a lot of flooding sometime. We have incidences of accidents with manholes, potholes, and all these things. So when it's raining heavily, be inside home. Don't venture out unnecessarily.
Thank you, doctor. Thank you so much. So this is it for today. We'll come with another video.
Lalita Exchange Utsav. పాత నగల అదే బరువుకి కొత్త నగలు తీసుకోండి. నో ఎక్స్ట్రా చార్జ్, నో డిడక్షన్. పులు చెల్లించి కూడా పథకంలో చేరొచ్చు. నగల ప్రైస్ లో 20% ఆదా చేసుకోవచ్చు.